CNA Expressive Aphasia Communication. Welcome to the quiz. Question 1. You are going off shift. Which of the following is the most important information to report to the oncoming nursing assistant during handoff report? Option A. That the resident had a small amount of bloody urine in their Foley catheter bag at 3 p.m., which was reported to the nurse, and the nurse is monitoring it. Also, the resident's sacral area is red and you applied barrier cream. Option B. That the resident's favorite TV show is on at 7 p.m. and they like the volume at 15. Option C. That the resident prefers their coffee with 1 sugar and no cream in the morning. Option D. That the resident's daughter visited and seemed very nice and friendly. The answer is A. Critical information requiring follow-up must be reported. Option A is correct because it includes critical information that requires follow-up, bloody urine, skin issue. Options B, C, D are preferences or non-critical. Question 2. A resident who is Muslim requires assistance with a bed bath. It is important to be aware that in many Islamic traditions, modesty is highly valued. What is a culturally sensitive practice? Option A. Expose only the specific body part you are currently washing and keep the rest of the body covered with a bath blanket at all times. Ask if they would prefer a caregiver of the same gender. Option B. Ensure the door is slightly ajar so you can hear if you are needed elsewhere, as privacy is less important than safety. Option C. Ask a family member of the same gender to assist with or perform the bath. Option D. Perform the bath as quickly as possible to minimize the time they are uncovered. The answer is A. Maintaining modesty and offering choice of caregiver gender respects cultural values. Option A is correct because it maintains modesty and offers choice of caregiver gender. Option B is incorrect because door ajar compromises privacy. Option C may be an option but not always feasible. Option D is not sufficient. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. A resident who has had a hip replacement is being log-rolled for linen change. You notice the surgical incision is slightly red, warm, and has a small amount of foul-smelling drainage. What is your priority action? Option A. Complete the linen change quickly to minimize resident discomfort, then report the condition of the incision to the nurse immediately. Option B. Remove the dressing, clean the incision with sterile saline, and apply a new sterile dressing. Option C. Note the findings in your charting and continue with the linen change, covering the resident back up. Option D. Tell the resident that the incision looks like it's healing nicely and not to worry. The answer is A. Finish the task safely, then report signs of infection urgently. Option A is correct because you need to finish the task safely, then report urgently. Option B is incorrect because CNAs do not change dressings. Option C is incorrect because documenting alone is not enough, reporting is needed. Option D is incorrect because it dismisses signs of infection. Question 4. A resident on oxygen therapy via nasal cannula complains of dryness in their nose and on their cheeks where the tubing rests. What is an appropriate nursing assistant intervention? Option A. Apply a water-based lubricant to the nares and a small piece of gauze or a commercial pad to the cheeks under the tubing, as per facility policy, to soothe dryness and prevent skin breakdown. Option B. Remove the cannula for an hour to give the nose a break from the drying effect. Option C. Use an oil-based lubricant like petroleum jelly to soothe the dryness and protect the skin. Option D. Increase the oxygen flow rate slightly, as higher flow adds more moisture. The answer is A. Water-based lubricant soothes dryness and protects skin. Oil-based can degrade tubing. Option A is correct because it soothes dryness and protects skin. Option B is incorrect because removing oxygen is unsafe. Option C is incorrect because oil-based can degrade oxygen tubing. Option D is incorrect because increasing flow doesn't add moisture. Question 5. You are providing a bedpan to a resident who has strict mobility restrictions. After the resident has a bowel movement, what is the proper technique for removing the bedpan? Option A. Roll the resident to one side away from you, holding the bedpan steady, remove it, and then roll them back to clean the area. This prevents spillage and is safe for the resident. Option B. Tilt the bedpan to one side to empty any liquid contents into a container before removing it from under the resident. Option C. Pull the bedpan straight out from under the resident from the front. Option D. Ask the resident to lift their hips using the trapeze so you can slide the bedpan out. The answer is A. Rolling the resident to one side prevents spillage and is safe. Option A is correct because it prevents spillage and is safe. Option B is incorrect because tilting under resident is awkward. Option C is incorrect because pulling straight can cause spillage. Option D is incorrect if resident cannot lift. Question 6. When making an occupied bed, what is the primary reason for keeping the side rail up on the opposite side of the bed? Option A. To ensure the resident's safety and prevent them from accidentally rolling off the bed while you are working and the mattress is moving. Option B. To make it easier to tuck in the fitted sheet on the far side. Option C. It is facility policy, regardless of the resident's mobility or cognition. Option D. To provide a convenient place to stack the clean linens while you work. The answer is A. Safety is the primary reason for keeping the far side rail up. Option A is correct because safety is the primary reason. Option B is not primary. Option C is not accurate. Option D is not primary. Great job! Don't forget to subscribe. Bye!